Good morning. It's about 7 a.m. Been up for about an hour. All ready to go though. Kids' stuff ready, my stuff ready. I've even done their sun cream, which is a long job on these hot days. Done my lateral flow, that's negative. We'll be off to the childminder soon. I drop them off about 7:30 so I can get into work before 8 to get on top of some admin. I'm just out in my garden watching the dog. She likes a little run around at this time of day. So I'll catch up with you shortly. And we're off. Kids are all in the car. We're off to the childminders and then I'll be in work. Got supplies, need my coffee first thing in the morning. Just arriving at work. Just going to put my mask on, do a quick change and then get logged on. So I've just jumped off a Teams meeting to talk about staffing related to COVID absence, any clinical updates, any change to guidance. We have various team members from HR, management, rota team and clinicians as well. Really useful half an hour that we spend twice a week. So now I just need to log on and see what kind of work I've got. I've already got a pile of admin here, some reports to write, some permissions for online access to sign. So we'll see what the day brings. So I'm starting here with a report. I like to get these done at the beginning of the day. So this one's for a universal credit. So have a look at the notes, see if there's anything I need to add to the report, and then we'll sign that off if it's appropriate. Just looking at my admin list here, we have what's called tasks, which is the kind of non-visible work of GP. So I've got some prescription requests to review, I've got some referrals to look at, some blood test results and some clinic letters to file. So there's lots of different things to look at. I tend to do that before I start my morning clinic, but also between patients. So this morning my clinic is for urgent same day stuff. So anything that really came in after 6 o'clock yesterday or over the course of the morning. And we try and keep that to local sites. So I'll be dealing with Parkview, Town Hall. And if we need to see patients, tend to have a look at the list, prioritise those patients that might need to come in, give them a ring or a text and say, you know what, do you want to just come down at 10 o'clock, we'll have a look at you. And those that will clearly just need a telephone consultation tend to do those later in the morning. So it's a really flexible way of working and allows us to prioritise those that are a bit more urgent earlier in the day as well. If you rang us at 8:30 pre-pandemic for a routine appointment, you would have been told they've all gone for the day. And people have forgotten what it was like. There was a move from NHS England to move towards more online tools to manage workload. I prefer the visibility. I much prefer to be able to know what's out there and not signpost people to NHS 111 inappropriately just because we're full to the rafters. This system allows us better continuity, better flow, and if we have short-term absences, actually we can adjust to that in a short notice rather than cancelling a whole clinic, which is what used to happen. But general practice is not going to go back to the old ways. The demand is too high. I mean, this is our home visit list, so we've got, across the practice, we've got 15 home visits, well, just extra, just less than. So we do, I mean, all of us generally do a home visit once a day, one a day, maybe two. Home visits are entirely valuable and definitely necessary. If patients don't need a home visit, that's another message that is really difficult. You know, if you can go to the hairdressers or you can go to an appointment at the hospital, why can't you come to the GPs? And Okay, and whereabouts in your tummy are you getting the pains? Okay, and is this something you've had on and off for months, years? It's a condition that really you can get on top of. It's not something you should have to put up with. That's a test for irritable bowel syndrome, basically. If it's positive, it suggests more of a inflammatory problem, so things like Crohn's and colitis. But if it's negative, it suggests that it is an irritable bowel. Which pharmacy would you like me to send that to? East Parade Boots. Okay. Any questions or anything else that you wanted to add? Okay, lovely. I'll send you that information via text. Once you've dropped in the stool sample, it takes a week to 10 days for the result to be processed. So if you want to have a chat about things going forward, contact us for a follow-up appointment, okay? So you can pick it up from Town Hall, you can pick it up today, I'll get it all ready for you. Beginning of March 2020, she would have had to book a face-to-face appointment. She'd have had to take time off work. She would have had an appointment now. I'd have examined her, I'd have done everything. And then I'd have said, oh, you need to have some follow-up. She'd have tried to ring in 4 weeks, probably wouldn't have got an appointment because it would have been too full, told to ring back the next day, might have got booked in with another person, and we were no further forward. Tasks is really variable. There's lots of different headings. So you're just looking at a few there. There's some that are medication queries that our prescription admin team need a GP to agree or disagree whether the prescription's appropriate. I've got referrals to send. I've got requests for advice from some of the nursing team. Some of these requests for blood forms or letters for travel that require that are, come with a charge and all of that. So that's a separate workload. So there's lots of different things that come through that task format, and I generally will do that spotting in and out throughout the day. Some people spend a defined time over lunchtime doing that, but I prefer to keep up with that throughout the day and keep looking at the tasks as and when I've got the time. So this whole system, both systems, Clinic and System 1, we can access remotely via our laptops, which is secure. So when I was self-isolating, I did a full day's work and can communicate with the team as well. We've got an instant messaging thing, so you can talk to your team as you need to, which is useful when you're working virtually or remotely. There'll be some face-to-face slots for another GP that's in that day, and you will basically give them some face-to-face work to be doing if you need to bring anyone down. So it's one thing about the pandemic is we've proven that general practice can be more flexible, and you can work remotely if there are needs to do that, whether that be health, childcare, preference, distance, whatever that might be. Certainly for the last 18 months, it's much harder to fit in breaks. It's much harder to fit in a good sit down at lunchtime or team meetings, just because it's constantly there's work to be done. So the waiting rooms are not a sign of how busy we are. The waiting rooms are really carefully managed so that we can make sure that people are coming through in a safe way. But telephone consultations are really valuable. Video, text, and also home visits. We're not going to be here if we're home visiting. So some of that admin takes up a lot of our time as well. So I wouldn't use the waiting room as a barometer of how busy we are. One of the girls I saw this morning, she's 14 and struggling with anxiety. She just couldn't talk on the phone, so it was entirely appropriate that she had a face-to-face consultation. I needed to pick up a little bit more, get that rapport that you get from a face-to-face. So it's not always those people that you need to touch, but we decide that on a case-by-case basis, really. He got to us at 8:41. I texted him pretty much straight away to say come down at 11:30. He came at 11:30. And here we are. Good stuff. Operator. Cancel. Operator. Hello, it's one of the GPs. Can I speak to the surgical reg on call, please? They're happy to see the surgical team on the surgical assessment unit this afternoon. Just any time that you can get there. What information you give to receptionists or patient central as we call them, is really valuable. The more information we have, the more likely it is that you'll end up with an appointment in the correct time with the correct person. You know, people, so if you call us up, Patient Central will basically fill in the same form than if you'd gone online. And for me, the people that do it themselves online get so much more valuable information because they've been able to take the time to write what it is that they want to say. So they'll write, I have been feeling low, depressed, I would like a sick note, I might want to talk about antidepressants. So you have a really good idea of what it is that's going through their mind. Whereas when they've spoken to someone else and you've got this information second hand, you might have depression, low mood, and not much more. But I think it's really important that we share how important it is that we know a little bit about the symptoms. They're not being nosy, they are highly qualified, and you know, you're much more likely to get the appointment you want actually if you do engage with the receptionist. They're not just Joe Blogs off the street. This guy, he was on my list for skin problems, and what's been really useful is I can see his skin problem. So he's written it himself, really nice detailed online form that he's filled in, how it's affecting him. Really, really valuable, because the fact that he's written white nettle sting like rash and I've got the pictures, I can diagnose him with urticaria without even him having to leave his living room or wherever he is. Yeah. 11 visit requests for the east side of York, so that's of Heworth, Fulford, Tanghall area. So I will just have a look. I count how many clinicians we've got in. It's an easiest way to do things. We have people visiting nursing homes, so lots of variables at play as to who can visit and how many visits. Now, so the real mixture of conditions here, from falls, confusion, dizziness, chesty. So there's lots of different things that we deal with home visits for patients that are unable to leave their home. GPs, salaried, I'm a partner, we all share out the visits equally. The partners quite often have other roles to do over lunch. So I'm a GP trainer, so I often am debriefing my trainee. He's not here today. We have meetings to do with various things through the CCG, PCN, but I often visit. We're not excluded from visits, and certainly, especially with longer term patients, palliative care, I would want to visit those patients sometime today. This is Emma, one of the other GPs. Hello. I'm okay, how are you? Who's gone home today? 2 more. Oh dear. Okay, well, we'll touch base later in the afternoon and see how it's going. 2 more staff members having to go home. So we'll see how the staffing goes this afternoon, but we'll always prioritise urgents. We'll always deal with anything that needs to be dealt with on the day. The one that went home this morning has got a cough. She's waiting her PCR results, so she's still able to work from home. So she's taken her laptop home with her. And then the other one, I don't know, it could be her child that's poorly and been sent home from nursery. So they're all COVID related, isolation related. So both can work from home. The difficulty we're having at the minute on demand is that we are seeing things that we shouldn't see in July. I can't remember when I saw bronchiolitis or croup in July, but our cough clinic or our COVID site is just full of children with bronchiolitis and croup in July. It's a winter illness, so that's one of the reasons why we're struggling a little bit to keep up with the fast pace of demand, really. We were kind of predicting a really big surge in infective illness, but the difficulty that is now on top of dealing with normal general practice demand, COVID-related illness, the backlog from the pandemic, the mental health pandemic that we're seeing in relation to the difficulty of the last 18 months. So there's no one thing that makes us feel like the demand is higher than ever. It's just lots of things being thrown at us. Long COVID is certainly having an impact, and those patients are really struggling with a number of physical and mental symptoms, so we obviously want to support them through it. There's now a long COVID MDT clinic at the hospital, so it's a new workload that we've not had before. There is some crossover potentially with other chronic fatigue syndromes, which hasn't necessarily had the limelight, which now hopefully more light will be shone on these longer term conditions. So yeah, another thing really to add to why the demand feels heavier. And we're all learning. We don't know what COVID will do longer term. We've had it for 18 months, 2 years nearly. What are the long-term effects? Heworth Green is usually kind of bustling with people. Like I said, there's 12 clinical rooms. We've usually got MSK, HCAs, nurses, various GPs, PAs. But today, we have 3 clinicians in this afternoon. So that's a mixture of people self-isolating at home, working from home, people being off sick, but also that time of year where people are allowed to go on holiday, and we would encourage people. So since COVID, I hadn't really had any proper time off, because even when I was off during the original, if I was at home, I was with the kids. You know, you never had quite time to step away from the kid. You know, parenting or working, it was either one of the two. But I made sure I took 2 weeks off in May, turned off social media, turned off everything. And it's so important that people have their breaks. That's what is sometimes leading to some of this burnout, is that we're all too busy trying to help everyone, save everyone. And it's just not possible. We need to just stop. Now people are going on holiday. You know, it's really nice to see people going on holiday, even if Scotland, Cornwall, Mallorca, just taking time to reset. I think it's so important. There's a real mix. I've already spoken to, say, the Macmillan nurse. So anyone that calls that needs a consultation, a conversation with a clinician. So I've spoken to a Macmillan nurse, I've spoken to a district nurse. There's another call for a community nurse. So that's what this list is for, just to make sure there's someone available. If a paramedic calls and needs to speak to someone, this is where it goes. So a lot of our work comes outside of, you know, what you would expect, people ringing for appointments, but there's also other people that are wanting our input, which I think is some of the invisible work that goes with general practice, definitely. Okay. Would you be able to come down to Heworth Green for one of us to check you over? What time do you think you can get here? We'll see you in a bit. Bye. So I'm back up to 30 tasks. Let's see what else we've got. Answer, so 2 in a row with no answer. Okay. Yeah. And have you got any pain in your ear? Yeah, just come down. 4:45. That's the good thing about general practice at the minute, is that it's not doctor-led at all. It's so many different healthcare professionals, and I think in a couple of years ago it was very much I want to see a doctor, I want to see a GP, but certainly behaviour is changing to show that other healthcare professionals, advanced nurse practitioners, advanced care practitioners, there's lots of acronyms, are just as effective. But the two things we found, certainly right at the beginning, was that we were seeing lots of ears and like breast lumps, because there's some things, or abdominal pain, that you just cannot deal with remotely, which is why general practice can never and never should be call centre based. There's always going to be that need for face-to-face for examination. So I've just finished up, I'm in my car, ready to get home. It's nearly 7 o'clock, still not finished all my admin. It's been a really busy afternoon urgent care, lots of same day cases, seeing in person, over the phone, some text, some video, varying cases, varying complexity, lots of different things to deal with. So 2 GPs dealing with the East Side work today. So busy afternoon, need to eat, need to refresh, try finish some admin so I can start tomorrow on the ball with a clean slate. So yeah, that's general practice. So it's 8:42 p.m. I'm just finishing up some admin. Last job of the day is to file all my scan letters. I have to log in for half an hour of an evening on a Wednesday. It's my first day in the clinical week, and admin tends to pile up, so I like to get rid of it ahead of my next 2 days of clinical work. So I've done a pile of tasks, pile of referrals, and just these results and clinic letters to file, and then I'll be done. Time for a cup of tea, and we start again tomorrow.